Hi everyone, welcome to our first Lunch and Learn series. We're just going to give it another minute or so. We'll get started in a minute or so. Thank you. Okay, I think we'll make a start. I've got that at 3 minutes past. So hopefully you can all see our screen. We can't see you because we've had to minimize it to see the slides. So if you do have any questions, please do pop them in the chat as we go. And our colleague Francoise is going to monitor the chat for us. And if there's any problems, Francois can help. So welcome everyone to our first Lunch and Learn session in our webinar series. And today we're talking about why it matters, the case for cancer screening and prevention. So what we'll be talking about today, and this is a session plan, so hopefully that's moved on and you can see that slide. We'll go through some housekeeping, we'll then have some introductions, we will then talk about what is cancer, what does screening and prevention mean, why it matters for people with an intellectual disability, and then takeaway messages and questions. Oh, my screen has now frozen. Sorry about that. So if you can, please mute your microphone. If you want to have your camera on, that would be great, especially for the question and answer section at the end so we can see you. As I said, please put any questions in the chat and we can go through them at the end. And the slides we've tried to make in plain English and similar to an easy read format. So they have pictures and then writing as well. But if there are things that you're unsure about or you have a question on, please do pop that in the chat and we'll come to that at the end. So a little bit about us. Hi, I'm Dr. Kate Sykes. I'm an assistant professor at Northumbria University in Newcastle in England. And a lot of my research and area of interest is around cancer screening, specifically for people with a learning disability or intellectual disability. But I've done work with Simon on lots of other things as well on learning disability. So I'll pass you over to Simon to introduce himself.
Hello, my name's Simon Milner. I live in Botton village, which I live in the North Yorkshire Moors. I also do some work with Kate Robinson, not Kate, Kate Sykes. Sorry. And I work in the cafe where I live in North Yorkshire Moors.
Yeah, and what do you like to do, Simon, in your spare time?
I like to go out to Middlesbrough, so I go on the train and things like that. So, and then I see my girlfriend as well. So
yeah, great. And you play football as well?
I play football, yeah.
Yeah. So you like to do lots of things as well, which is great. And we've made these slides together, and a few of the slides, I'll ask Simon a question, and Simon will say whatever he wants to share. Okay. So we're going to start off with what is cancer. So Simon, what does cancer mean to you? When you hear the word cancer, what does that mean?
So I think when I think of cancer, I think of like maybe like lumps and bumps and things like that. So like bumps and things appearing in places. So for example, I've gone through cancer myself. I had a lump under my arm a couple of years ago. Was it about 6 years ago now? But which I just randomly woke up one day, and there was this lump the size of an orange, and then obviously I then got that tested, and then I found out it was stage 4 Hodgkin's lymphoma. So it was a type of blood cancer. So what I always see is I always think of lumps and things, but it can be other stuff as well. It's also about like cells going into overdrive, I would say.
Yeah,
That's my understanding of it really.
yeah,
So I can see
absolutely.
it as like it's just one cell mutating and then just copying and basically making the same cells over and over again.
Yeah, absolutely spot on, Simon. So when we were chatting and we were making these slides, we used the word AWOL. So you can see that on the screen. And for those that aren't from the Northeast, that is just what Simon's described is that the cells are replicating. So one cell will go bad and then that will replicate and replicate and replicate. And as Simon said in the quote on the screen, it kills off the other cells in the body. So you're absolutely right, Simon. Cancer is a condition where the cells grow in the body and they become uncontrolled. So some tumours are benign. So, Simon described there that he found a lump under his arm. That might have been like what we call benign and not cancerous. But unfortunately, Simon's was cancer. And that's what we call malignant, a malignant tumour. And cancer cells can spread to other parts of the body, so they can remain in that kind of tumor site and location, but they can spread and go AWOL and move about to other parts of the body and kind of spread that cancer. So that's how cancers develop in different parts of the body. So, Simon, when I said to you, what does cancer prevention mean? What do you think that means?
I would say it probably means like making sure that you've eaten a decent diet and things, because if you don't eat a decent diet, you will probably increase the chances of getting cancer. It's also you should be going and getting regular checkups, maybe at the doctors when they recommend it for you to do so.
Mm-hmm.
So I would always say when the doctor's recommending for you to go and get them done, I would say go and get them done, really.
Yeah, really well done. That and there's you give a really good example, Simon, there about having a healthy diet and eating healthy. Simon and I have just been part of a project, haven't we, looking at lifestyle interventions and not just about going for cancer screening and things like that, but how we have healthy lifestyles as well and how we can help people with an intellectual disability have healthy lifestyles. And we talked about eating healthily being one part of that process. But it's got multiple factors, cancer prevention. And like you say, people often see of it as, oh, I must just stop smoking or stop drinking, but it can be all of the things that are on the screen. So yes, if you smoke, reducing that consumption or stopping, ideally, having a reducing alcohol consumption, fizzy drinks, processed food as much as possible, and increasing the healthy options, fresh fruit, fresh vegetables, oily fish, the things that we know are good for the body. But it's also other things as well, such as using SPF, protecting ourselves in the sun. Now, not many people know that it's recommended that we wear SPF every day when we're kind of out and about. It's not just us, going on holiday and wearing sun cream. When we're just on holiday, we should wear that as often as we can. It also includes having vaccinations. So one of the main ones at the minute around cancer is HPV, which we know has been linked to preventing multiple cancers, as well as cervical cancer. Having a healthy weight, as much as possible, and then and being active and exercising as well. All of them things and engaging in all of them activities can reduce somebody's chances of developing cancer. Now, it's important to say as well that some cancers run in families, so that's what's called like a genetic predisposition. Some things are inherited from kind of grandparents and parents. So again, that can increase somebody's chance of having cancer. So that's why prevention is really important, to just do what we can to reduce risk as much as possible. And one thing as well that especially important for our work, I think, Simon, as well, something that we've done a lot, is about knowing your body, knowing the signs and symptoms of cancer, knowing what's normal for you as a person, know what your body looks like. So then you know when changes are happening, you know what if there's changes there. And that you talked a bit about that, didn't you, Simon, about the lump that you
because I already knew that wasn't normal when I saw it, to be honest.
Yeah, because you knew before that wasn't there. Yeah. And did you know, Simon, about was there any other signs that you might have been unwell, or were you fitting healthy to what you thought?
One thing that I did have was I had a cough that was on my chest that didn't go. So I obviously, before I knew I had the lump, I bought some cough stuff. But obviously, when I used that, it didn't actually go. And then obviously, I then got the lump, and then obviously found out when I went to the hospital. I got it. What's it when they take a sample?
A biopsy.
Yeah, I had a biopsy done, and then obviously found out it was Hodgkin's lymphoma.
Mm-hmm. So yeah, you didn't necessarily know that could be a symptom of, like, you just thought it was a cough. Yeah, so I think again that links in with knowing what's normal for you, knowing what's a normal lump and a normal bump in someone's body, you know. But as soon as we know something's not right or something changes, then that's when we know to go and get help and speak to somebody who might be able to help. And what Simon and I have been doing within Camp Hill Village Trust and another organisation that I work with is we've been doing some education sessions. So the pictures on the screen are from two locations that Camp Hill run, and we've been running some cancer and screening workshops, and we had a bit of a like a quiz, didn't we? So that's the top picture that you can see. So we asked questions, and then we asked people in the room if we thought they were false, and if they were false, they would hold up the red card, and if it was true, then they would hold up the green card. So we wanted to share that with you all, to kind of say that interventions and helping people don't always have to be expensive or complicated. You know, that was something that I made on my living room floor, and the easy read leaflets on the bottom screen were free to get as well. So, you know, I think that's a really good example to share how we can help people know about cancer in a non-scary, informal way. So yeah, just wanted to share that with everyone. Did you want to say anything about the education sessions?
I thought the education sessions were really useful, especially for letting people know in the village that I live in. Obviously, it's good to talk about this, because without obviously it being talked about, then it's like it will just be brushed under the rug and not actually ever spoken about. And this is something that you really should talk about, because it's very important.
Yeah. And some people said that, didn't they, Simon, that, you know, they're a bit scared of cancer, and they're scared of that word. And if people hear the word cancer, they automatically think that means they're going to die. And we talked about that, didn't we? And we kind of said that's not the case. You know, it can be treated, and the earlier we find it, hopefully the better the outcome for people. So I think, yes, it is a scary and upsetting topic, but we managed to talk about it in a nice, informal way that people we think got a lot out of. And I know people were kind of still walking around with the leaflets and the booklets a few days after the session, telling other people, which is exactly what we want to do. So you've talked about the lump, Simon. Is there anything else that you wanted to say about signs or symptoms? No?
I think I went into detail earlier on about it.
Yeah, about the lump. Yeah, great. And so we've talked a little bit about signs and symptoms and prevention, and screening is one part of that. So what do you think of, Simon, when you hear like cancer screening?
I think getting obviously screening is very important because it's obviously trying so you don't have any symptoms. So it's obviously so when you're getting it done, then it shows you that maybe you don't have it. So then you get it tested, and then after that's done, then it's not like because obviously you need it really because it's a prevention really. So that's why I would say screening is so important.
Yeah, yeah, and I would totally agree as well. And some of the quotes on the screen were what we said, what Simon and I were talking about when we made these slides. Sometimes in screening, cells are taken and checked. Sometimes we need to provide a poo sample. Sometimes it's an X-ray. So that screening looks very different for lots of different places of the body. But screening is a way to detect cancer early. It's not a diagnostic tool. It's a way to then go on to potentially have a diagnosis. Simon said about having a biopsy. So screening, if there are any concerns, would then lead on to further tests. And people are invited for screening because they don't have any symptoms. They're not through a cancer pathway. So as best as we know, people are invited because they are fit and healthy and don't have signs or symptoms of having a cancer. There isn't a screening program for every single cancer. Simon had non-Hodgkin's lymphoma. So Hodgkin's lymphoma. I always get it wrong.
That's a
different one. But there isn't a screening program for every cancer type. They're only specific. So again, that's why it's really important that we know the signs and symptoms and knowing the body. So then, if something changes, you can get help. Screening programs differ per country, and I think that's important to acknowledge, especially within the CUPID project. But the common programs that we know exist across countries and across Europe are cervical screening, breast screening, and bowel screening. Now, again, some of the specifics might change across countries, but their overall aim is to do the same thing, and we'll talk about that in a few slides' time. But in terms of cervical screening, it looks at most of the time now it's looking for the presence of the HPV virus, which is present in the cervix, and that's the opening of the womb in somebody's vagina. And everybody who has a cervix should be offered screening, regardless of whether they identify as male or female. As long as they have a cervix, they should be invited and have screening. So within that, a swab is taken and it's tested for HPV. If HPV is identified, then it will be kind of looked at in more detail to see what the cells are doing, if the cells are changing. And again, that might then lead on to further appointments at the hospital and further tests being done to confirm whether that is a cancer or not. So this, I can't see because of the banner there. I think we said there what it is about cervical screening. So what do you think about cervical screening? You remember what we chatted about?
I think it's very important. Like I was also because I was talking to Kate, I think it's a few weeks ago, and I was saying how come that they don't do it earlier, because there's a lot of younger women who have died from cervical cancer. So what I was thinking is why they don't get the screening done earlier. But then you obviously said about hormones and things, and obviously at 25, then that's why they do it at 25. So
Yeah, and there's been lots of people who have petitioned for that to be a younger age, and kind of saying that it should kind of happen as soon as somebody, becomes sexually active. But there is evidence to say, 25 is there for a reason, due to kind of lots of changes happening prior to the age of 25, that it might then lead on to like false positives and false negative results. But yeah, we had quite a lengthy conversation about that, didn't we? I'll just move on to the next screen if it's going to let me. Yeah. So again, breast screening is predominantly inviting people who are registered as female. But again, there's lots of guidance on for the trans community and the transgender community about who need to be involved and where. But essentially, if somebody is registered as female with their GP, their doctor, they'll be automatically invited for screening. And through screening, it's an X-ray of the breast tissue called a mammogram. And through that process, the machine flattens the breast tissue to see what's inside, and the images are reviewed to see if there's anything in there that needs checking. Like I say, it's looking for kind of abnormalities within that breast that might be cancer, but it's also looking for things such as like cysts that aren't cancerous. And interestingly, within breast screening, I know that research is now testing AI and whether AI can be used to review the X-rays to see if that's better than a person reviewing them. So the programs are always changing and attempting to be improved as well. And the bowel screening program invites males and females, and essentially within the UK, again, I'm going to base this slide off for the UK experience. A home testing kit is provided when somebody hits a certain age, and then it asks them to provide a sample of their poo to be analysed to see if there's blood within it, which again might indicate that somebody might have a cancer but might not have a cancer and might have polyps and other things.
Usually 50 for the country.
I think it's 50 to 70, I think, for in the UK, but again, the ages differ for different countries, but I think it's more of like the older population where cervical is for 25 and above. But again, similarly to cervical and breast, if there are abnormalities identified, then further tests will be required from that person. There are a few innovations that are happening again within the UK specifically, and they're testing out targeted cancer screening programs. So again, it's just to make people aware that innovations are always happening within screening, and different cancer sites and locations are being introduced. So they're operating targeted lung screening within the UK, and that's for males and females who are current or former smokers aged between 55 and 74. And again, that's to check, have an X-ray of the chest to look at the lung health, to diagnose lung cancers as early as possible. And again, this is a relatively new implementation that's been trialled as targeted prostate screening. So this would be males only, or people with a prostate, age between 45 and 69. And they're only inviting people who have the BRCA1 and BRCA2 gene mutation, which we know is linked to other cancers as well, to have their prostate checked, because we know the BRCA1 and BRCA2 mutations can lead to some aggressive forms of prostate cancer. Screening has positive and negatives, and I think that's important to acknowledge that, yes, we want as many people to have screening as possible, but there are some bad things. So there are false negatives and false positives, and we had a chat about this, didn't we, when we made the slides about what that means. So sometimes people get a negative result or a normal result, but actually something's been missed. Take the bowel screening, for example. You might provide one sample that doesn't have blood in it, but if you'd have provided another sample from the same, stool, that might have had blood in it. So that sometimes that happens. And similarly, some people get false positives. So it suggests that you have a cancer or a possible sign of cancer when you don't, and that might then lead on to having treatment when you might not have actually needed it. in the first place. So that's what's called overdiagnosis. So, you know, it might be that the cancer is diagnosed and treatment happens, but that would have never been needed potentially. And there are some side effects for the screening programs, especially cervical and breast. They're not the most comfortable procedures. Cervical can lead to kind of some light bleeding. People don't like talking about poo either, or kind of handling that. For Simon and I worked on a screening project, and we were working with somebody, weren't we? And they were like, found it really funny, didn't they, about talking about poo and doing that screening program, because they just didn't like it, did they? They're just like, nah, I'm not doing that. So that uncomfortable feeling is a side effect that kind of happens to screening, and ultimately what puts people off going for screening. But we think it's really important that we talk about cancer screening, cancer prevention for people with an intellectual disability. Research tells us that people with an intellectual disability have a shorter life expectancy, and many of their deaths are from avoidable causes. So these are things that could have been prevented, you know, if things were identified sooner, or things were put in place earlier, that death wouldn't have happened. And cancer is one of them leading causes of death. Now, that's not to necessarily say that the cancers are from cervical screening or breast screening or bowel screening, but it's from a cancer diagnosis. And we know that people with an intellectual disability are more likely to get certain types of cancers as well, and they're more likely to be diagnosed later when cancer is harder to treat. And that's because of what's called that diagnostic overshadowing. So often people, you know, with an intellectual disability might report a pain in their tummy or something, and that's just kind of dismissed as you know, part of their behaviours or something like that, when actually that is a sign of something not quite right and needs treatment or looking at. In addition, some people with a learned intellectual disability won't know how to, you know, look for signs and symptoms, won't know how to check themselves. They won't know what needs checking and why checking it themselves is important and why screening is important. And that's part of the reason that we did them education workshops, to try and explain to people that, you know, it's a good thing. You know, it's a way to look after yourself. And we know from statistics that people with an intellectual disability are less likely to get screened. And that's partly linked because they face more barriers in accessing health services. You know, and thinking about the project Simon and I have just been on about healthy lifestyles, they might not know how to be healthy. And they might not know that, you know, eating takeaways 4 days a week is bad for the health, or they might not know how to swap out certain things to just make them a bit healthier. So we just think as a group that it's really important that we talk about how screening and prevention initiatives can be made accessible and inclusive to people with an intellectual disability to hopefully have a better, healthy lifestyle. Is there anything that you wanted to say, Simon, about the barriers for people, you know, going for screening or taking part in intervention?
People with disabilities.
Yeah.
I would say one of the barriers would be is if it's about getting to the screening, I would say. So like some people might not be able to get to appointments and things like that. I would say I was fortunate where I am that I have really good I have good staff, so I managed to get to my appointments and stuff. But there will be other people that might not necessarily be able to. Yeah. So I would say that's a big barrier.
Yeah, and having that like trusting relationship with staff, I think, is really good. Like if you've got really nice, good staff and you have a good rapport with them, then you might be more likely to say, "Oh, this doesn't feel right," or "This has changed." And we've said on the screen there, like people with an intellectual disability are often offered like annual health checks, so that's an appointment with a healthcare professional, and often that can be the start of talking about screening and preventative measures to help people be healthier. So lots of research has been done on the barriers to screening and prevention. members of which are part of the CUPID network, and just some are on the screen, and there are many, many more. So one of the factors is the confusing letters and the appointment system, that often letters aren't in an accessible, easy to read format, that, you know, they come through the post, and it's just kind of assumed that somebody will be there to help understand that. And not, like you say, Simon, you said you're really lucky, you've got really good support staff, but people might not have that support to be able to explain letters and appointments and things to people. People are scared. Yeah, the people don't want to go for these tests because they don't want to know if they've got cancer, yeah, and what that might look like. So people are scared of that. They're scared what's going to happen. They don't know what's going to happen, and then that can lead to anxiety. And the kind of one that I kind of want to talk about is that people get told with an intellectual disability, or there's this stigma in some places that screening is not for them, especially cervical screening, because often what we see in the literature is that people will make the assumption that people with an intellectual disability are not having relationships, are not sexually active, but that doesn't matter. You know, we don't think about that for people without an intellectual disability. So, you know, if you meet the criteria, everybody should be invited to go. But what we find is that there are multiple and complex barriers out there for why people don't engage in screening programs and preventative measures. So is there anything, Simon, that you wanted to add about what gets in the way of people going for screening and, you know, engaging in like prevention stuff?
I would say maybe I would say getting out and getting to the appointments really, and then as you were saying about probably also maybe some of the letters. So if you've got letters and things that some might not necessarily understand if they're reading, because some of the stuff is quite complicated to read. So there'll be all like stuff with what the doctors would have put in, and then you might not necessarily understand what the doctors are saying on those letters.
Yeah, absolutely.
So I would say that could be a barrier as well, because you might not necessarily understand what you're reading.
Yeah, absolutely. I mean, when Simon and I were making these slides, we were chatting about where Simon lives. It's basically in the middle of it's very rural, in the middle of the North Yorkshire Moors. So if somebody gets like a screening invite there to go for like cervical and breast screening, that's a big transport need, isn't it?
You then have to go to the hospital to then get screening, really.
Yeah, and it requires like staff to then be able to support you and take you, and it's quite complex. And I just want to kind of talk about the bubble there on the screen about exercise is important, keeps you healthy. Some people find it difficult to exercise. Someone in a wheelchair might find it difficult, you know, so I think that's important where we think about reasonable adjustments and how we make things person-centered for people. And, you know, people can still exercise in wheelchairs, but it's a different way. And I think it's been clear that people can still do things, but it's what is within their ability, you know. So we talk about their ability, not what they can't do. Yeah, and we talked about that, didn't we, on the Lean project. So I'm coming towards the end of our slides now. And we just wanted to highlight that everyone needs the right support. So people with intellectual disability may need extra support to make healthy choices, and may need support to understand what screening is, and if they want to do it. You know, screening and prevention is a choice. Yeah, we can't force anybody to do it, but we need to make sure and help people understand why screening is important, why improving healthy lifestyles is important, why having vaccinations is important, you know, so they can make that informed decision about whether it's something that they do or don't want to do. And it's not about blame. It's not about saying, oh, well, carers think this, or doctors think this, or, you know, researchers think this, and people with intellectual disability think this. It's about just removing them barriers and working together to create an accessible and an inclusive environment that, you know, people with an intellectual disability can make these informed decisions about if they want to go for screening and make some lifestyle changes. And if they don't, then that's their choice. But we know that that's come from a place of education, and that they understand, you know, the decisions that they make. But the key thing there is that we all must work together to make screening and healthcare just much more accessible and inclusive for people with an intellectual disability. And some key takeaway messages from us that Simon and I wanted to raise: that access to screening and prevention is a right, it's not a privilege. You know, everybody should be invited if they meet that criteria. And people with an intellectual disability should be supported to have healthy lives and have screening if they want to. And through the CUPID cost project, we're hopefully identifying ways to improve prevention and screening for people. And something that I always say, and Simon's probably heard me say this multiple times, that when we get it right for people with an intellectual disability, when they get the support that they need, that everybody benefits.
Yeah.
You know, often we think people with a intellectual disability are like a second thought sometimes, and we kind of say, well, if we think about what people with intellectual disability need first, then that's going to make it more better for everybody as well. But often, unfortunately, as a collective, they're often an afterthought. Right? All people with an intellectual disability aren't going for screening, and why? If we make it better from the outset, it might just make it just better for everybody. So Simon, final words from you. Is there anything that you wanted to share with our colleagues, or anything about why screening and prevention is important? Anything else that you want to say?
I was going to see if there's any questions about them, so just wanted to know if there's anything that anyone wanted to say.
Yeah, that's grand. And I think we've got a question slide next. So on the next slide as well, after this, there's some URL links to some resources that Simon and I have kind of pulled together. And before we take questions, so there's the useful slides, we just wanted to raise our next talk in the series is happening on the 29th of April with our fabulous two colleagues who were talking about statistics and the numbers behind the need, cancer statistics, screening uptakes, and cancer inequalities. So please do keep a lookout for the joining link for that webinar. And yeah, Simon and I are more than happy to take any questions now. So yeah, thank you, everybody.
Thank you.
So Ed's just said, excellent, thank you, Simon and Kate. You're very welcome, Ed.
Thank you.
Yes, Julie, please.
Hi, sorry, I'm not used to Zoom, so I'm not sure where the put your hand up to ask a question button is. First off, great presentation. Thank you very much, Simon. Thank you, Kate. Really informative and great to hear about the work that you're doing. I just wanted to share a couple of things really, and I'll put some links in the chat if that's okay.
Absolutely.
So as Kate knows, I work for the Learning Disability Network at the moment in the North East and North Cumbria, and we have a number of courses called Be Screening Aware that cover all of the adult screening programmes. Those courses are now all online, and that includes sort of a trainer package, all the resources that you'd need to deliver and promote. So I'll put a little link in the chat, so if anybody wants those, they're very welcome to just pinch with pride, you know, take and use if they're going to be helpful, adapt them to the groups that you're working with, and I'd be really happy if they get used more widely. They're designed to be delivered by people with intellectual disabilities or people with a learning disability to that community. So yeah, and the other thing was, where can we get a recording of this? Because I have some colleagues who I'm really keen to share it with. So that was my second thing.
No, thanks, Julian. Thanks for joining, and great that the resources are online, because like so much work and effort went into them. I was just wondering, lots of our colleagues in the CUPID project are from like non-English speaking countries. So I'm guessing they're okay to kind of translate them if that's, yeah, they're okay to do that. Grand. Francois, I don't know whether you wanted to come in and talk about the sharing the recording and things.
Yes, so we have recorded this webinar anyway, so it will be made accessible. I think the plan is also to put it on the CUPID project website. So we'll follow up on this. We will have the detail of everybody who joined in today. So we'll be able to send an email and follow up.
Thanks, Julie. Yes, Chris, please.
Thank you both. So if I may, I had one comment and then a question for each of you. Oh, by the way, hello, I'm Chris. I work at Warwick Screening. So my comment is to say thank you for talking about the harms and emphasizing the choice. So we struggle a lot with explaining screening to people, to the general population, because people think it is the solution to fighting diseases, and it isn't. It causes a lot of harm. So thank you for that. So to Simon, there's loads of things that we don't know about in screening.
Yeah.
What would you recommend as the things we should be looking at first to help people with disabilities?
I think probably maybe making it a bit more, maybe understanding why it's important to actually go for the screening, because I mean, maybe not a lot of them maybe quite understand that it is as important as it really is. So I would say maybe making them a bit more aware about it. Would you say that?
Yeah, I think it's quite a complex thing, isn't it? And understanding is only part of it. And I think the way that screening is changing at the minute, it is especially cervical screening. You know, they're doing lots of innovative things to kind of do things more at home than opposed to like going to the GP and trying to like listen to people, where they're saying there's lots of barriers in going for appointments. So doing things at home might be better.
I was also going to say, I know that maybe there's people with intellectual difficulties that might if they hear the word screening, they might get scared of that, because then obviously they think it's like, they might think of the worst, really. So that's something that's a bit like, maybe if it was like in a more of an easy read, maybe, so then it's not. So obviously when they're doing an easy read before they go out and doing for some screening, then they might actually not be so scared.
Yeah.
Thank you. And then Kate, what have you got coming up research-wise within screening?
Lots, actually. So Julie and I, a while ago, put in a bid, didn't we, Julie, to look at how we could do things on similar to the Be Cancer Aware, but for younger people with an intellectual disability. You know, so trying to get some education into schools, colleges, you know, way before screening is ever on people's radar, to try and reduce some of that apprehension around cancer. We didn't get that funded, but it's on my to-do list to kind of look at that again, you know, to see whether we can still get that into another funder. And I've got some other research going in, not relating to learning disabilities, but looking at cervical screening methods and the acceptability of HPV, you know, some of the innovations that are happening around HPV, and specifically women in prison settings, how they might find, you know, doing a urine sample, is that going to be better, or is that going to cause more concern around, is that then going to be tested, you know, for illegal substances and all that type of thing. So yeah, so lots of screening stuff going on in the background.
Brilliant. Thank you very much. Wonderful talk.
Thanks, Chris, and thanks for that comment. Yeah, anyone else? Mairead, I can see you're unmuted. I don't know if that means that you've got a question or something that you wanted to ask. No.
You're getting lots of lovely messages anyway, so well done. Definitely the format was great, I think, for all of us.
Make sure Simon, I'll go through them with Simon at the end, so he sees all of them lovely messages as well. But yeah, if anyone has any other questions that they think of, you know, after the talk, I'll put my email address in the chat now. And me and Simon speak on like a weekly basis. So if anyone has any questions for Simon as well, I'm happy to, you know, take them and field them your way if anyone does have any.
Yeah.
And actually, just thinking, Chris, about what you said then, think about what Simon said. I've actually got some funding, non-cancer related, but links to what Simon was saying about easy reads to make some template easy read research documents at part of the university. So that thinking about that universal design for research and people with an intellectual disability being wrongly excluded from lots of research studies. I'm trying to create some template easy read documents that hopefully advocate for people who haven't done research with or involving people with an intellectual disability, that, you know, they've got a template there to start that process of making their research accessible from the outset. And Simon is working with me on that as well. So that would be great if we can do that, and we're using co-production as a core element of that, involving people with an intellectual disability. And what does that document need to look like? How do we define, you know, what an interview is in a non-scary clinical way? You know, that can just help people make that informed decision if they want to take part in the research or not. So yeah, so again, keep an eye out for any outputs that I make from that. But that's really exciting, isn't it? We're looking forward to doing that one. Oh, and I can see Julie's just put a comment in the chat. Great, thanks, Julie, that's wonderful. I'm just conscious of time, and we're coming up to 10 to. So if anyone has any last questions, or maybe one more question or comment, I think we'll probably have time. No, not a problem. So thank you again, everyone, for joining the Lunch and Learn series, and keep an eye out on email for the next sessions and the recording. But yeah, thank you all for joining and listening to me and Simon. So thanks, everybody. Have a lovely day, and we'll talk soon.
Thank you.
Take care, everyone. Bye.
Thank you.